Good morning, ladies and gentlemen. Bonjour, mesdames et messieurs. A very warm welcome, Madam Minister, Madam Director General, ladies and gentlemen, representatives of the quadripartite, representatives of the European and international organizations. We are delighted to have you join us today for this One Health, One Science Symposium, organized by the Higher Education, Research and Space Ministry here in France. We're very honored to be gathering a very large number of leading experts, researchers, policymakers and decision makers to gather to explore with us the inseparable links that form this interdependence between the human, the animal, and environmental health. This is what we're going to go through today and, of course, tomorrow. This makes our symposium the perfect introduction to tomorrow's One Health Summit. Now, before we start, please allow me just a couple of housekeeping points. First of all, we have interpretation available in French and English. If you need interpretation and you have not yet got your headset, they're available just outside the room, so feel free to get one. I would also make a plea to all of you. Please respect the timing throughout the day. We do have a pretty tight timing, so when we have a break, whether it's for coffee or for lunch, please, we'd be very grateful if you could be back in the room at the specified time. Thanks in advance for that. And finally, we will be using an online system, Mentimeter, for questions to our speakers during the panel sessions. So when we have panel sessions, you'll be invited to send your questions through Mentimeter, and this will also allow you to vote on recommendations, but you will see that in a few minutes when we show you the QR code to do so. So this is just a sort of warning announcement. So let us not waste any more time, and it's now time to officially open our event. So please, ladies and gentlemen, welcome Ms. Eleonore CAROIT, French Minister Delegate for Francophonie, International Partnerships and French Nationals Abroad. Madam Minister, please.
Good morning, everyone. I will be speaking in French as Minister of Francophonie, so please be sure to have your headsets. Great, thank you. Madame la Présidente Directrice Générale du CIRAD, chère Elisabeth, chers directeurs et directrices d'organismes de recherche, chers experts et expertes, chères participantes et participants au One Health Summit, mesdames et messieurs, en vos grades et qualités, tout protocole observé, je suis vraiment ravie d'ouvrir ce matin l'un des premiers événements du One Health Summit, ce d'autant plus qu'il s'agit exactement de ce qui est au cœur du One Health, c'est-à-dire d'un colloque scientifique international. Votre colloque, mesdames et messieurs, associe plus de 300 chercheurs français et internationaux. Et je tiens à vous remercier très sincèrement, ainsi que le ministère de l'Enseignement supérieur, de la Recherche et de l'Espace, qui coordonne votre mobilisation. Merci donc à l'ensemble des participants qui ont fait le voyage jusqu'à Lyon, parfois comme moi que depuis Paris, mais parfois de très loin. Donc merci d'être ici ce matin. Et puis si vous êtes français et que normalement c'est un jour férié, merci d'autant plus de votre présence en un lundi de Pâques. Ce colloque, c'est l'aboutissement concret de notre ambition pour One Health, celle qui a été exprimée par le président de la République dès l'annonce du sommet. One Health, ou une seule santé, parlons quand même français, c'est un rendez-vous pour rappeler que la santé de toutes et de tous passe par la science, par la recherche et par l'innovation. Le village des découvertes nous en donne un avant-goût depuis hier, et si vous n'avez pas encore été le voir, je vous recommande vivement de le faire. Nous disposons de réponses concrètes, opérationnelles aux enjeux de santé globale. Mais pour pouvoir les mettre en œuvre au niveau mondial, nous avons besoin d'une excellente concertation entre les différents acteurs et d'une action éclairée par vous, mesdames et messieurs, par la science. C'est l'objet de ce sommet et cela passe évidemment par votre travail. Nous vivons, nous le rappelons régulièrement, dans une période de grande inquiétude, de forte incertitude. Au niveau mondial, l'expérience scientifique est contestée, noyée par un déferlement de fausses nouvelles, par une confusion qui est souvent érigée en système et qui en plus est dopée aux algorithmes. On le voit partout, on le voit aussi en France. Or, la France défend une science indépendante, une France audible, une science collective, ouverte, partenariale. Nous l'appelons de nos vœux, car il en va en réalité de notre sécurité collective. Et les enjeux auxquels nous faisons face ignorent les bulles informationnelles. Ils s'imposent brutalement, et nous l'avons tous vu, vous le saviez, mais nous, on a pu l'expérimenter il y a 5 ans, lors de la pandémie du Covid-19. Alors, Madame la Présidente Directrice Générale du CIRAD, chère Elisabeth, vous nous rappellerez dans un instant les fondements conceptuels de l'approche One Health. Mais comme je vous le disais, la récente pandémie nous en fournissait une illustration très concrète, palpable et compréhensible par tous. L'imbrication des santé humaines, animales, végétales et environnementales est apparue très directement, de même que les conséquences désastreuses des crises sanitaires globales sur nos économies, sur nos états d'esprit, sur notre santé mentale. Alors nous ne pouvons plus nous laisser surprendre, il faut que nous soyons prévoyants et il faut pour cela que nous puissions créer des ponts véritables entre les disciplines, des ponts entre les chercheurs et la société civile, entre le monde économique et les pouvoirs publics. Et c'est pour ça que nous sommes ici, aujourd'hui et demain, à Lyon, pour bâtir une action internationale qui se fonde sur la science et sur le multilatéralisme. Ce colloque, mesdames et messieurs, couvrira les principaux facteurs des maladies infectieuses et non transmissibles, à savoir les réservoirs zoonotiques, la résistance aux antimicrobiens, les systèmes alimentaires durables, et vous savez que nous sommes très engagés sur ce sujet, l'exposition aux pollutions. Tous ces axes, ce sont des enjeux qui sont largement communs, qu'il s'agisse de l'accès aux données, de la prise en compte des facteurs socio-économiques ou encore des questions éthiques. La feuille de route stratégique que vous nous présenterez aujourd'hui va devoir guider notre action, la légitimer aussi, aux yeux de la science, bien au-delà de ce sommet de Lyon. Je vous invite donc, mesdames et messieurs, dans la continuité de la dynamique qui sera née de ce colloque, à chercher des synergies avec d'autres panels internationaux que vous connaissez, le GIEC, l'IPBES, l'ISP, CWP. Et c'est cette approche One Health qui, grâce à vous, essaimera nécessairement. Alors, je vous souhaite à toutes et à tous des échanges fructueux. Je nous encourage collectivement à fréquenter les différents événements organisés ces 2 prochains jours, car ils seront propices à susciter de nouvelles idées qui alimenteront à leur tour notre action collective. En 1782, le marquis de Condorcet, qui était un mathématicien, comme vous le savez, un esprit complet, était reçu à l'Académie française. Et dans son discours de réception, il disait « La raison a enfin reconnu la route qu'elle doit suivre et saisi le fil qui l'empêchera de s'égarer. » L'esprit des Lumières nous allume encore, en particulier dans une ville comme Lyon. Et aujourd'hui, c'est vous qui tenez ce fil de la raison, dans un monde, encore une fois, fait de désinformation, fait de croyances plutôt que de savoir, fait d'opinions plutôt que de faits. Vous pourrez toujours compter sur la France pour soutenir vos travaux et pour garantir la place de la science dans nos sociétés. Je vous remercie.
Thank you very much, Madam Minister. Ladies and gentlemen, I'd like now to welcome the President Director General of CIRAD, Ms. Elisabeth CLAVERIE de Saint-Martin, please.
Madame la ministre, chère Eleonore, Monsieur le directeur général de la recherche, chers collègues, chers amis, tout d'abord, je voudrais vous remercier sincèrement d'être ici, comme l'a fait Madame la ministre. Vous êtes venus pour certains de très loin. Aujourd'hui, c'est votre journée. C'est une journée qui met aussi en lumière tous les efforts que vous faites chaque jour sur ce sujet qui nous tient à cœur, le sujet de la santé unique, du One Health. Ce n'est pas une journée qui peut symboliser ces années de travail, puisque c'est ce que nous allons voir aujourd'hui, c'est que cela fait longtemps que les scientifiques travaillent ensemble sur ce sujet. Je voulais aussi remercier sincèrement les équipes, toutes les petites chevilles ouvrières qui ont permis cette journée, notamment les collègues du CIRAD et de l'ANSES qui ont été extrêmement impliqués dans le montage concret de ce colloque. Et puis, je voulais aussi remercier le ministère de la Recherche, de l'Enseignement supérieur, de la Recherche et de l'Espace pour nous avoir soutenus dans cette entreprise et cette proposition, ainsi que le ministère de l'Europe et des Affaires étrangères pour aussi avoir donné cette visibilité internationale qui nous est chère. Et enfin, et ce sera le sujet de demain, je crois qu'il nous faut aussi remercier le président de la République pour avoir donné à ce sujet du One Health cette visibilité, en avoir fait un des One Planet Summit. C'est important pour nous. Je voudrais souligner dans le peu de temps, et nous ne sommes qu'à l'ouverture, je ne vais pas préempter les débats scientifiques qui auront lieu tout au long de cette journée et que j'aurai le plaisir de suivre avec vous, 2 points. Le premier point, c'est que, je l'ai dit, la science a énormément travaillé sur ces questions de One Health. Toutefois, nous sommes à un moment crucial, un moment où il faut aller vite, dans l'interdisciplinarité, la transdisciplinarité, où il nous faut aussi aller vite dans les données qu'on met en commun. On va voir tout ça. Nous avons beaucoup de questions, nous avons beaucoup de défis. Le changement climatique va vite et a aussi un impact. Et nous sommes à un moment où les moyens financiers deviennent plus limités. Il va nous falloir nous serrer les coudes, comme on dit en français. Il va falloir que nous travaillions beaucoup plus ensemble, en réseau, et c'est l'objet aussi de cette journée, travailler en réseau global, pour arriver à continuer à faire avancer la science à la hauteur des défis du One Health. Le deuxième point que je voulais souligner, c'est que quand on travaille sur ces sujets, on travaille pour la connaissance, la vérité, pour la démarche scientifique, mais c'est aussi parce qu'on veut avoir un impact dans la vie quotidienne des gens, parce qu'on souhaite les protéger. Et sur ce volet-là, il va nous falloir travailler sur différents niveaux d'approche, et tant sur les approches locales, puisque c'est là aussi sur le terrain, ces approches territoriales que se font les politiques les plus proches des citoyens, que sur les politiques nationales, où s'engagent la plupart aussi des financements et des priorités. Et bien sûr, nous sommes à un niveau global sur les politiques globales et voir comment la science en tant que base scientifique, les données, les évidences, comme on dit en anglais, mais aussi comment la force de nos travaux peut soutenir, irriguer ces 3 niveaux de politique et comment nous pouvons, tout en restant à notre place, qui est celle de la recherche de la vérité, de la production de données, de l'ouverture et de la transparence, comment nous pouvons aider finalement à construire un monde plus sûr, un monde plus juste, un monde meilleur. Ça fait beaucoup, mais je crois que la science a les moyens de contribuer à ces valeurs-là que nous portons aussi aujourd'hui dans ce sommet One Health. Donc, je vous remercie par avance de votre participation active à cette journée de débat. Et puis, toutes nos discussions seront rapportées demain lors du sommet. Et j'espère que, bien sûr, des conclusions positives en seront tirées. Je vous remercie à nouveau de votre présence et de votre travail. Merci beaucoup.
Thank you, Madam Director General. Ladies and gentlemen, the time has come to dive into the core of our discussions and to open the first issue for today. We will look at how a One Health approach is more necessary than ever when it comes to emerging infectious diseases and antimicrobial resistance. To do so, I'd like to invite the 3 discussants who are going to open the topic so that we then have our panel discussion. So please welcome Wanda MARKOTTER. She's from the University of Pretoria. She's also the co-chair of the One Health High-Level Expert Panel. Good morning to you. Hervé RAOUL from ANRS MIE, that's the Emerging Infectious Diseases Agency. And joining us as well is Jean-Yves MADEC from ANSES Inserm, that's the National Agency for the Security and Safety of Food, Environment and Labour. So welcome to you all, and thank you for joining us. Don't worry, we'll take our time, there's absolutely no rush. And I will give that to you because you will need it. Sorry. So welcome to all three of you, and as you will see, our speakers have coordinated their session between them, and I'm going to give the floor to Hervé and then Jean-Yves, and they will be directly interacting with Wanda. So I'll leave it to them, and Hervé, I'll invite you to please kick off.
Thank you very much. Good morning, everyone. It's a little bit impressive to be here with all these participants. And I'm really happy to introduce the topics on EID and also AMR with my colleagues. We will just give you a flavor of what will be discussed afterwards, but it was important also to show you what will be the frame of this. And if I may, yeah. So, focusing a little bit on emerging infectious disease, I think the reason why we are talking about that in this kind of a meeting is that everybody knows that emerging infectious disease most of the time come from the environment, with a huge role of the zoonoses and also of the environment itself. So there are two ways we are facing at that time with the emerging infectious disease, is that the fact that some reservoirs are within animals in the environment, but others emerging infectious disease can be vectorized by also animals. So that's something very important. And we have seen that and learned lots of lessons, of course, after the COVID-19 pandemic, but also with previous outbreaks. Ebola in West Africa was a kind of surprise with a close link between the environment and the human health. We have seen afterwards Zika in South America, and also many others. And every year now, we have emerging infectious disease that we did not saw before. For example, the last year, we had 3 main outbreaks in Africa associated to filoviruses. So it is something that is very important. And each time, the lesson is more or less the same. So we don't know what is circulating in the environment. Most of the time, we don't have any available countermeasures. So we have made lots of progress, I think, in the field of diagnosis and detection, but many things still to be developed and supported at the level of medical countermeasures also. And the reason why the progress have not been as expected, it's because most of the time we address the question to different communities that were not so used to work all together. And this, I think, have to change. And it is a very good opportunity to talk about this within this kind of a meeting dedicated to One Health. Of course, we are not going from zero, because since many years, works has been launched and initiated, but there are lots of things that need to progress also. So based on this, it has been discussed with a group of experts, and here today, I'm just talking on behalf of this group of experts, because it's not the work of a unique scientist, it's the work of lots of experts, so at the French level, but also at the international levels. So thanks to them. So, what has been learned is that, of course, there is a clear need for prevention and detection and surveillance in the environment. That does not work really at the present time, and it has to be maintained and supported in the future. The approach that we want to support is to be in position to stop the spillover of zoonotic disease. That's something very important. And the last thing, of course, is to try to look at all the field that should be supported, going from prevention to research. So here you have the main recommendation that has been proposed by the group of experts. So the 2 first ones are dedicated to prevention, and the first one is probably a more strategic one, where it is clear that the prevention and the detection has to be embedded within public policies. So that's something very important. Afterwards, we need, of course, to develop specific systems that make possible and fluent the detection from the environment to the human population. It is something really of main importance. Of course, to have a global approach is key, and we need this kind of support, but we need also to not forget that the situation in the different territories will be different. So for this, we need also to have to develop specific systems that are more adapted at the territorial level. And the two other ones are also of main importance based on what has been concluded by the group of experts. It is that, of course, if we want to be really effective, we need to activate all the compartments and to take into consideration all the compartments. So it is important that we be in position to work all together because, of course, what has already been launched in the frame of the environment itself will be very helpful, trying to anticipate what is circulating, to also be aware on what should be proposed in terms of public health situation, and also to try to see which kind of countermeasure, medical countermeasures should also be prepositioned in different territories. And the last point, I think that is also of main importance, is also to take into consideration the way we use the land. And of course, there are lots of things to develop and to support and to improve at the level of the urbanization, but also for land use itself. And I think this was the last recommendation, and I will give the floor to Jean-Yves.
Thank you very much, Hervé. So let's go for AMR. So AMR is also a very, very pressing issue, health issue, one health issue, and again, we will just take this couple of minutes to set the scene. I will also present the recommendations from the group. It's not my recommendations, it's the group recommendations issued from a very vast group of experts from national and international relevance. And we will have the opportunity to discuss those recommendations in the next panel. But now, my point is to explain, and I would like to convince you that AMR is One Health. Also, let me take the opportunity to present this symbol of AMR. This is the international symbol of AMR. So please keep in mind, and you may observe people with this kind of symbol on the vest. This is the AMR symbol. It's very important to have a symbol also to tackle AMR in such a way. So why is AMR One Health? So AMR, you can see there, mobilizes the three components of the One Health. Because, as was said also earlier, animal health, human health, and the environmental health are extremely linked. And we know that bacteria that carry AMR genes and mobile elements can transfer from one sector to another one. Not only the bacteria themselves, but the genes can transfer from one bacteria to another one. So there are two levels of transmission. That's very important, and it makes the transmission of AMR very efficient. And here are listed a couple of reasons why, which reasons are to take into account to explain why AMR transmits so efficiently. Management of antibiotics, inadequate infection control, contamination of the environment. You can find residues in the environment, antibiotic residues, but also AMR bacteria, AMR genes. So everything is connected, and we need to quantify. This is probably something which is still weak in the science of AMR. What do we know exactly of the flux, the quantification of the different transmission pathway between the different components? We don't know much. We know that AMR can transmit from this side to this side, but what do we know at the global level on what is the real quantification of the transmission pathways? Okay, and also migration of people and animals infected with AMR, and all this contributes to the widespread of AMR. So what are the main drivers of AMR in a One Health approach? So most of them are listed here. Of course, the use, and the massive use, the excessive use sometimes of antimicrobials in human and veterinary medicine. Of course, the lack of access to clean water, sanitation and hygiene in humans and animals. Poor infection control measures in hospitals and in animal husbandries. The lack of access to medicines sometimes in a lot of locations around the world, and vaccines. Lack of awareness and knowledge, and some irregularities with legislations. There are many others. Those are the main ones, but there are others. But really, in all the sectors, we can find those reasons active. Wildlife is also affected by AMR. So it is quite a global issue. Those, like you have a very nice picture of a stork transporting AMR genes and AMR bacteria from one part of the globe to the other one. So everything is connected, and you can imagine also that those pathways, migratory pathways of wildlife is also very much connected with the climate change problems and all these global changes at the world level. We're talking about One Health. One Health means humans, animals, and the environment. But when we think of AMR, I think we think the use of antibiotics in humans, the use of antibiotics in animals, and the environment is far away from that. Actually, it's probably underlooked, because you know that all the genes that cause problems in clinics, that cause AMR in clinics, in humans, in animals, come from the environment. They are located in environmental bacteria in the environment, and they come to us. And also, vice versa, the environment is polluted. The environment is polluted by antibiotic residues and AMR bacteria. But this part of science is still overlooked, and probably we should have a deeper insight in the role of the environment in the One Health approach of AMR. And I was saying that AMR is linked to global pressing health challenges. We know that. Climate change is one of them. Pollution is one of them. So it's also to explain to you that why AMR is one of the 4 topics here, but all of them are very connected with food system, pollution, emerging infectious disease, and AMR. Okay. Those are the recommendations highlighted by the group, and you will have the opportunity to discuss them in the next panel. But just a flavor of them, just for you to have them in mind. The first one is to consider antibiotic, and I would say antimicrobials in general, as a public good, really a public good. And I would be very interested in how you define what is a public good. How would an ecologue, not a physician, not a vet, how would classify the critically important antibiotics? How this classification would have changed if it were classified by an ecologue? This is an interesting question, I think. Second point, implementation of One Health national action plans. Every country around the world should have a national action plan. And not only a national action plan against AMR like that, a One Health national action plan. And we should continue and help countries and push countries to adopt national action plans. And this could be also done through a meta-network, a network of networks to help, to coordinate and to strengthen synergies between the different initiatives to push countries to have national action plans. Also, the science policy society interface is really important. Probably is also not so developed, and we need, it is a problem for people. It's not just a scientific problem, it's a problem for concrete people every day. So we need to strengthen the link between society, policy, and science. Also, the global challenges, we have seen that in the first slide. It's really important to interconnect AMR with the global challenges. Another one is to promote One Health innovations. One Health innovations means that it means that if you have progress in one sector, you can have benefit from these progresses to the other sector. okay, not have in silo progresses in human health, in animal health, and the environment, but try to have one health innovations. And then to integrate agricultural systems and value chain into a more strategy. So I will not go deeper into these recommendations, and we will have the opportunity to discuss them in the next panel, as I was saying. But now, with Hervé, I think we will have the chance and the honor to ask you some questions on One Health. I give the floor to Hervé, sorry.
Thank you, Jean-Yves. So, Wanda, I think the first question was on the reason why we need, for all these topics, to have a One Health approach. Maybe you could give a flavor of seen from the international level and at the highest level you could imagine. What would be your vision on that?
Thank you, and it's a pleasure to be here, so thank you for the invitation. I'll speak a bit across emerging infectious diseases as well as AMR, which is actually great to do because most of the times we have separate panels for AMR and emerging infectious diseases, but I think I will also highlight a few points of why it's important to discuss these two together. So for us to sit here and talk about One Health again in this context, we need to be convinced that it's necessary. We need to understand why we're talking about this again, because One Health is not new. Why are we saying now that we need to look at this? And I think we've heard from the previous speakers that if we talk about EIDs and AMR, it is really at the interface of animal, human, and environment. What is important in terms of One Health is the interconnectedness of this. So it's not just looking at the animal, the human, and the environmental part separately in silos, but it's really about the interconnectedness. And if we talk about EIDs in the context of One Health, we need to know where it's coming from. And some of the previous speakers alluded to that we've got this diversity in nature, pathogens that's there. They're actually quite happy if we leave them alone, then they don't spill over to people and other animals. But unfortunately, during the past few decades, we're seeing more and more spillovers of these pathogens, most of them zoonotic, and with a very strong wildlife focus. A lot of them are present in wildlife that you've also heard from the previous speakers. There's reasons why this happens. There needs to be an interface where there's contact between these pathogens and humans or other animals that we can call intermediate or bridging hosts. And these interfaces can be direct, so there actually needs to be a contact with a bat or a rodent or a bird, or it can be more indirect through environmental contamination. And this is also where One Health becomes very important. It can be indirectly through fruit, contamination or other routes, but then also your intermediate hosts. And here's also where we need to also think about vector-borne diseases and intermediate hosts. So how does the figures look? It is actually staggering if we look at human lives. We can't really put a cost to that. That is something that we don't want to happen. But if we really look at economic costs, COVID, trillions of economic losses. I think most countries are still feeling the burden of COVID. Some will never recover. Some communities will never recover. We should also not forget that there has been other examples before this. We forget that SARS coronavirus 1, it was 2003. It's already 13 years ago, but we seem to forget the impact of that. That was also around $52 billion US, going to the low and middle income countries, Ebola in Sierra Leone in West Africa, also billions of economic losses associated with those diseases. And then Zika, which is affecting South America, Caribbean, also billions of economic losses. So the figures don't lie. We don't want to be in this situation where we have these economic losses over and over again. It's also the same for AMR. I mean, I'm not an AMR specialist, but I look at over 1 million deaths a year. The projections are if we do nothing, this is going to be over 30 billion, I think, 30 million deaths. Now I need to get my figures right. 39 million deaths by 2050. This is staggering amounts that we're looking at. And what is the problem? We can't just ignore and keep on doing what we're doing and keep on trying to control these diseases in humans because it's obviously not working. There's huge losses associated with this. So it's really clear that we need to think about a different approach. And there is an approach on the table, but it's really about how are we going to implement this? What are we going to do? What is the barriers and enablers to not doing this? So the discussion really needs to move to that, and not just saying, do One Health, do One Health, do One Health. Why are we not doing it? And what is the barriers and maybe creative ways to actually do this on the ground? I think I'll end there.
Thank you very much, Wanda. I think the second question is for you, Jean-Yves.
Yeah, thank you, Wanda. You were saying that the nature is really rich. There you use biodiversity in nature. Many dangers from there coming, storming to the human populations and creating diseases. So I would like to have your view on what are the main drivers for emergence. I was saying that, for instance, for AMR, I'm not an EID person, I'm more an AMR person, but, well, it's more or less the same. The genes responsible for AMR are present everywhere here in nature. And we have very nice examples of those genes having colonized the human and animal populations, coming from nature, from the soils, from the bacteria in the soil. And we don't even know when the next one will happen. So what are the drivers for emergence from nature?
So I think there's several, and I always say drivers is very context specific. You know, so we've got these lists of drivers. I mean, every time there's a new review and it's the same list over and over again of what's the drivers of EID and AMR. But it's very context specific. So I want to put that on the table first, because although we speak about examples, it may not be true for every situation, and we really need to unpack where we need to address what. But drivers is really what is bringing infectious agents and also antimicrobial resistance close to people and close to other animals. So that interface needs to happen. I always say it's about that contact interface that we need to look at, and that's where the drivers is important, and we will hear a lot about that today, but broadly it's some anthropogenic factors, climate, I'll say something more about that, globalization, growing populations, the things that we deal with across countries is also drivers of emergence of AMR and EIDs. And then also, as we heard from you with AMR, microbial adaptation, that's also true for EIDs. There's also some adaptation of pathogens in the EID space. So we really need to think about things like environmental drivers, and there, climate change, how vectors are distributed, if we talk about vector-borne diseases, is important. Land use, deforestation, same things you hear over and over. Water scarcity, I've heard that also in one of the previous talks. Biodiversity, human-related drivers, really important. A lot of these things are driven by human action, and that is what's bringing us into contact with pathogens and also driving AMR. You will see in some of the recommendation, urbanization is highlighted quite a lot, and how we do that actually responsibly going forward. Mobility, global trade, encroaching into wildlife habitats. That's why I use the framing of where pathogens come from, because that interface is increasing. Food systems is important in this space, and especially things like intensified food production that I think will come up also in some of the discussions, and intensified livestock production also specifically, and looking at live animal markets where species are mixed. It's really interfaces that drive pathogens to spill over to humans and also other animals. We will also, and I'll leave that to the later sessions, but drivers is also the lack of governance, the lack of systems, the lack of proper surveillance systems. We also have to have this in place across sectors. Otherwise, that will also lead to drivers. Just maybe to increase of EIDs and AMRs. Just maybe something about climate change. I think if we think about climate change and climate hazards, we also always think about vector-borne diseases. And we forget that it's also really important in the AMR space, but also in the emerging infectious disease space. And there was a paper published by Mora et al. A while ago where they looked across different pathogens at the impact of climate hazards. And over 1,000 of these pathogens that we see regularly, and this is not just zoonosis, it includes tuberculosis and some of the other pathogens, are increased by climate hazards. And this is things like drought, floods, changes in vegetation, even ocean level temperatures and levels that rise. So we really need to recognize climate effects across the board and how that's going to change the space of AMR and EIDs going forward as a driver. I think I'll stop there.
Thank you very much.
Maybe another question to you, Wanda, because I think now we have a kind of more clear picture of the situation itself, but you know the context, the international context, national context in many countries is a little bit complex. So how you see the way we can address all the issues you mentioned just before?
Yes, I think that's what's, getting to countries and getting to people and even to researchers, including all of this, where you look at animal, humans, and environment in one package, sounds complicated. And you actually need to bring a lot of actors together to do that. So I think we need to recognize it's not that simple. It's across sectors, it's across ministries, it's across disciplines that doesn't even know each other's language most of the time. But we must remember we're not starting from scratch, and this is why I'm going to put my OHHLEP hat on. So in 2019, when COVID was really in our minds, and in 2020, there was discussions actually by the French government and the German government on how are we going to go forward and do this better. And that's where at that point, the tripartite, which is WA, the WHO and FAO, then came together with UNEP, that brings in the environmental aspects, to really look at One Health collectively. And that is also why OHHLEP was created, the One Health High-Level Expert Panel, to also give scientific advice in this space. And a lot has happened since then. OHHLEP was established in 2021, and also the quadripartite was formally recognized in an agreement after that. And there's been plans put on the table. There's the One Health Joint Plan of Action together with the implementation plan. And I think sometimes we take this out of the research space and we put it in the policy space, and we don't even look at those documents when we think about research. And it's actually very important that cross-communication happens and that we recognize these policy or high-level global documents also on a practical research level in terms of what we do. So those documents are there. There's been fundamental work done on definitions, on theories of change, of what prevention actually means. And that's maybe an important other point. We need to move from being reactive, where we look at what is going on in the human population, to prevention. And here we don't mean prevention just by using vaccines in human populations. We mean prevention at the source of, for instance, spillover, or at the source of where antimicrobial resistance is happening, trying to prevent as many of those pathogens to actually spill over. And that goes back to the drivers, to the interfaces that we need to address. And there's no way that can be addressed in silos, because it needs that multi-sectoral approach. It needs integrated surveillance where we put all of this together and we do really intelligent things with the data, where we cross-look at what is happening in the environment, what is happening in animals, what is happening in humans, and then we can actually see if there's early warning signs that can lead to action and risk reduction. So I think we need to recognize that there's a lot of things happening on the global level. It's also on the national level. My colleague here mentioned national One Health plans. That needs to be in place, and you're going to hear a lot of examples today about countries that's already doing that. I've just been through the exercise with South Africa, and we also included a part there on research and innovation, which I think is critical to also be part of these plans. It can't just be a policy document. So I think these discussions helps us to really link what is already there and then talk about, like I said at the beginning, about what is the enablers and the barriers to not doing this, and how we can also strengthen commitment going forward.
Wanda, I'm afraid we're going to have to wrap up this introductory session, but we're already right into the heart of our discussion. So thank you very much to all three of you for joining us and setting the scene for our first session. Thank you.
Thank you.
Thank you.
Now, ladies and gentlemen, before I open the next panel, just a quick couple of steps back. You probably saw earlier on the slide with the QR code that I mentioned. So that is the QR code that will allow you to ask the questions to our panelists in the panel that's coming up now, but also allow you to vote on the various recommendations that you will see in the list and highlight what represents for you the most essential one in each topic that is going to be developed throughout the day. So feel free to do so. There's the QR code. You can scan it now. You can use the same QR code throughout the day, and you can vote throughout the day. And of course, the questions you can prepare during the session. We will try and save a few minutes at the end of every panel to read some of your questions. So go ahead and take part in the discussion. So now is the time to build upon the introduction that we have just had and see what recommendations have been made in terms of EID and AMR. And to do so and take us through the panel, I'd like to invite Marisa PEYRE from CIRAD.
Merci beaucoup, Florence. Bonjour à tous, distinguished guests, dear colleagues, dear friends. It's a great pleasure for me to be here with you. We've just heard why it is very critical to take a One Health approach to be able to tackle health risk for emerging disease, for antimicrobial resistance. So now it's about time to dive into the how, and with a great expert panel that I will call in a minute, we will discuss through practical example what are the enabling conditions to be able to turn One Health into action in the ground. So first, I would like to welcome Professor Nitish Debnath. Nitish, you are a retired professor and founding Vice Chancellor of Chittagong Veterinary and Animal Science University. You are also a member of the OHHLEP and a member of the PRESOD initiative. Welcome. Then I would like to call on stage Professor Priska Mugabe. You are an associate professor in livestock science in the Faculty of Agriculture and Environment and Food System from the University of Zimbabwe. You are also the Africa Regional Representative of the PRESOD initiative. Thank you. Welcome, Priska. Please, Professor Bruno Gonzalez-Zorn, please join us. You are the head of the Antimicrobial Resistance Unit at the Complutense University in Madrid, and also a member of the One Health group in the Global AMR Hub, and chair of the One Health in UNA Europa. Welcome. Professor Ziyong Si, you are a professor in the microbiology department at Michigan State University. Please welcome on stage. And last but not least, I would like to call from Professor Ramanan Laximinarayan, who is the president of the One Health Trust. Please join us as well. So thank you very much. So to get started, I would like to ask you, Nitish. So you were very involved in the development and the coordination of the One Health platform and national policy in Bangladesh. Bangladesh is often cited as a strong example of this operationalization, and we've just heard that national action plans are very needed. So can you tell us a bit more about that?
Thank you, Marisa. Ladies and gentlemen, it is a privilege to come here to talk about Bangladesh. And, you know, I will be telling you three important things. One, the process of One Health implementation and institutionalization in Bangladesh. And then I will focus on where is the energy coming from. And third, what is the immediate future for us. So if you see these slides here in front of you, you know, at a period of time when there was a lot of nervousness in our country, particularly with the Nipah and avian influenza, we started to think, what can we do for the country? And there was a professional energy coming from, awareness coming from, and we organized a One Health conference in 2008, what we called in Chittagong, and we called it Chittagong Declaration. And that declaration contains important two parts. One, why One Health? And we answered to that questions in a very brief way that Bangladesh is typically a One Health country. It is a small country, too many people, 56,000 square miles, and 180 million people, and a lot of environmental crisis, too many animals as well. So the proximity is so close, we decided to go for One Health. Second thing that we decided in the declaration, how is it going to be done? And we answered to this question that we need to build up a whole of a society movement, and we have to buy government, a whole of a government approach. And for that thing, we launched a One Health movement, what we call One Health Bangladesh. And between 2008 to 2012, we have intensively campaigned with the government, different sectors campaign, and came up with a sort of what we call One Health strategic framework. And that was a very comprehensive document, very persuasive in action, very participatory. And after 12 and 12, between 3 years, we campaigned to endorse that document by the government. And it was approved by the government. And in 2016, we established 3-tier coordination mechanism. And finally, we went to sort of One Health journey. And during this period, you know, it is not only talking, advocacy, but we came up with some action, like joint outbreak investigation, capacity building, also as sort of what we call the surveillance, joint surveillance activities, and all those activities we are doing. Now, if we move to the second, and where is the energy coming from? What we call, it is a very organic development. When we started to do these things, it was basically a professional awareness. And from that One Health Bangladesh put the journey, I can see here, you know, when we started the conference in 2008, it was around 250 people. And the last conference that we organized in 2023, we had more than 1,000 people, 3 days conference, very intensive discussion. This is a policy discussion with science, society, and the government. This is how it was moving. Secondly, that what we can see that it is not only a particular time, a conference, we were very intensive with the seminar, symposium, discussion, and continuous. And this One Health movement also joined with the One Health Secretariat that we established very continuously. And finally, the last, you know, after COVID, we organized another revision of our, third revision of our strategic framework. And that is developed into 5 things. It has been approved by the government now. We have also asked for more investment. For that thing, we really made some case studies for investment, and also expand and inclusive from national level coordination mechanism up to the subnational level. And finally, we are also advocating for more investment. And the last slide, if you see here, and you will see that we made 6 case studies with the support of the World Bank. And this case study shows what is the cost-benefit ratio here. If you see in the laboratory one, and then the surveillance one, and the progressive and zoonotic disease, endemic zoonotic disease, eradication, elimination and control, and also if you see the food safety issue. And the fifth one is the AMR, antimicrobial resistance. And the last one is about the vector-borne. You'll see the highest cost-benefit ratio is from the food safety issue, and then continuously go to the laboratory capacity, detection capacity, surveillance, also the progressive control of zoonotic diseases, and finally also in the vector-borne disease and AMR. All these things together, Bangladesh is working as a sort of movement as well as a whole of a government approach with the support of different agencies like WHO, FAO, UNICEF, even World Bank is coming up with a sort of project. If you see in the next part of this slide that we have got, this world, what you call the pandemic fund. This is one source of funding. And the last one that we are strongly advocating with the government for more investment. And we got another project that is called One Health Project, 3 ministries together is going to be implemented in Bangladesh with a soft loan from the World Bank, 250 million, 5 years project. And the pandemic one together, we are on a journey of One Health. Thank you very much.
Thank you very much, Nitish. Thank you. So we have heard also earlier on that those things need to be context specific. There is not one action or one plan that will fit it all. And we've also seen in the recommendation, both for AMR and EID, that community-based surveillance is very important. Priska, you have been working across Southern Africa in strengthening One Health's capacity at the national and community level. Can you share how this translates in action in the field?
Thank you, Marisa. Do we have the slides? Okay. Okay, thank you very much. I am going to share our experiences from East and Southern Africa through an initiative we call COHESA, or Capacitating One Health in East and Southern Africa. This is an initiative for multi-level, multi-dimensional capacitation and facilitation. The project has been implemented in 12 countries with diverse contextual settings, and it has been implemented through national implementing partners that we call multipliers, with the great support of a consortium made up of the International Livestock Research Institute, CIRAD, and ISA AfriCenter, of course, made possible through funding from the EU and OACP. So COHESA was looking at various approaches, including governance, capacitation, communication, building knowledge systems and sharing of knowledge, and also innovations for solutions. And some of the outcomes that have come up from COHESA include, like we had from the first session that we had, the importance of strategic plans. 8 out of the 12 COHESA countries actually have developed their strategic plans, some of them even with implementation plans. We've also had quite a lot of input into education and curriculum, right from early childhood development to the tertiary level, universities and schools. And also, another example is the innovations that we've had at the community levels through interventions for solutions to come up with solutions for addressing challenges that we face in the One Health realm. So I'll give you two examples of those initiatives that we've had. The first one is facilitating capacity for value creation from rural solid waste. In this context, we came up with a situation where people normally think of addressing waste management from an urban setup. But if you see the picture on the extreme left, this is a rural setup, a rural business center where you have plastic waste accumulating. You have interface with animals in that waste. So COHESA capacitated a rural waste sorting and handling center. where communities were facilitated in terms of the importance of this waste in the One Health context and how they could create value through that center, which also brought other partners that were outside of COHESA, particularly the Environment Management Agency, which came up with a lot of training for the communities in how to handle this waste. And so we had communities being capacitated to process, collect, process, sort, and compress the plastic waste. And you can see a van on one of the pictures of that waste being carried to an urban center where COHESA had facilitated a linkage between that organization and the community so that they could actually get paid for that waste. And the next example that I'm going to show is capacity for animal waste to cooking energy, which also saves on trees. So on the extreme left, I don't know whether that's your left or my right, you see an animal or two animals, a donkey, and so you're talking of multi-species there, a donkey and a heifer, I think, are drinking from waste wash-off from a rural slaughterhouse. Now, that's a potential One Health time bomb. So what the COHESA team did through a competitive grant from universities that were outside even the COHESA team. So this university came up with an idea to say, if we facilitate the creation of biodigesters so that animal waste, whether it's coming from the animal slaughterhouse or just ordinary animal excreta, could be fed into this digester, and then you create energy, cooking gas. And what I like about that example is that gas from that particular, because we had several being created, that particular biodigester is feeding into a school, into a food and nutrition class. So that girl there is doing it as part of a food and nutrition, but she's using biogas from those digesters. So this is, I think what we heard from the early sessions is where you bring, I think Wanda said, bring different actors together. Whatever one sector has done very well, it can add value to another sector. So what we are seeing there is an energy intervention supporting even a school, but in a One Health context. Other examples that I will end up with, other than the two examples that I've given you, we have had a lot of capacitation for surveillance, community-based surveillance, with multiple actors from different ministries coming together to do their training for surveillance. We've also had capacitation in terms of zoonotic governance structures like zoonotic committees being capacitated, even coming up with strategies. I think we saw that in Kenya. We've also seen community nutrition intervention because, like the Director General said at the beginning, we have to impact the daily lives of the communities. It has to go beyond interest groups coming up with this topic of One Health, but how do we make it impact the communities? So those are only a few examples that we can share from COHESA. Thank you.
Thank you very much, Prisca. And you'll have a chance to say much more about it. And thank you, because you've managed in one example to bridge together all the themes of the conference: pollution, food system, AMR, and infectious disease. So well done. Bruno, I will turn on to you because you have been focusing on antimicrobial resistance, and Spain and Europe are often highlighted as a success in reducing their risk and their use. Could you explain what made this possible in practice?
Yes, of course. Thank you very much. If we can see the presentation, so I'm very happy to be here today.
Don't worry. We will... Here we go.
Okay, so I have 3 or 4 minutes to be here together with you. No, first slide. First slide before, Marisa, please.
Sorry.
Okay. No, next one. Yes. Stop. Thank you. So I have 4 minutes to be with you. I've been challenged. So in 4 minutes, I will tell you about 4 success stories that we have had in Europe and in the world, and something that I do not want to be a funeral. So stay concentrated, because I hope that we don't have a funeral today and tomorrow. So I will explain you what I mean with this. So 4 weddings means 4 success stories that we have had on AMR in the world and in Europe. Next slide, please. This is the first one. We started in 2004 in Europe with a network that was called MedVetNet, medical people and veterinary people working together for the first time, even before the term of One Health was invented. So and we are here today not because of a chance that suddenly Emmanuel Macron was convinced that One Health was important. It's because French people have been working very hard for the last 20 years on antimicrobial resistance and on One Health. And in fact, this network had a permanent secretariat, guess where? In France, in what was called their AFSA, now ANSES, now ANRS. So France is really at the heart of One Health, of the environment, animals, and humans work together in this coordination. So thank you very much for bringing up One Health to the top level where you have brought it today. So this is a true success story that was born in this country. Next one. From then on, we went to Europe. And in Europe, we decided, and this MedVetNet Association today has developed to the European One Health Association, which exists and is one of the most important stakeholders today in One Health in Europe. The next story was, let's not stay in Europe, let's go abroad. So we, in the European Union, we decided to go abroad and to organize meetings and conferences in all the countries in the world, bringing together, with European money, health ministries, agricultural ministries, and environmental ministries to tackle and to teach them how to make a proper national action plan on the One Health basis. And we go there thinking that we have to teach people. But the fact is that in low and middle income countries, we have to learn. Because probably in many countries in Southeast Asia, in Africa, and in Latin America, sustainability and equilibrium with the environment is much more developed since 500 and 600 years than we are doing today. So be careful when we think of we have to teach in other countries what to do, because I think that in most of the places we have to learn how things are done and have to be done in terms of sustainability and equilibrium with the environment. Next slide, please. Teaching is very important. So if all of you and all of us have learned and studied in one university, we have realized today that we should not study in one university. So in Europe, we have European alliances of universities. And so one of these alliances is called Una Europa. There are many, but this one is powerful. And in this alliance of Una Europa, we have decided that One Health is the main pillar. So people are being taught today in 11 universities in Europe, all together by the best professionals, because we have professionals from all these different 11 universities, and we have alliances with the US, alliances with Africa, and alliances with Latin America. So we have the best teachers, and we are, as an academy, we're working together with the quadripartite and together with the agencies, which means that working together also as universities in the academy is probably the way to teach the next generations on a One Health scenario. Next slide, please. And back to research. We have done a pilot study in Spain. As you know, we have a national action plan that is very much One Health, and I will go back to that later. And we've done a pilot and study, and it was said by Jean-Yves and by Wanda as well. Real integrated surveillance is not so easy. So we went to a small village in Spain, which is called Ronda. Some of you may know it, down there in Malaga. And we made a surveillance of everything. And everything means elderly homes, school, hospital, people, wildlife animals, extensive pigs, intensive pigs, of everything together. It's complicated to organize. And there we realized for the first time how quantitatively bacteria move between humans animals in the environment. And as we can see there, and we just finished the manuscript, so we'll send it. You can read it soon. This is worldwide the first time that we show this. We have seen how bacteria from pigs, when they are extensively reared and treated with antibiotics, which we shouldn't do, are able to make it to the hospital and physically kill patients. And this happens through the movement of bacteria, and this happens through the movement of plasmids, which have antibiotic-resistant genes that are selected in animals and then make it to bacteria that are then endemic in our hospitals. So this is the way that we can see how bacteria really move from the environment, between humans and elderly homes, school, etc. So this is what we have to do. This is a very nice pilot study for the first time, and this is what we have to do. Integrated surveillance, real integrated surveillance, not different ones, with real digital data sharing and taking the samples exactly for the purpose, not using just the data that we have, really taking the data for the purpose of how do bacteria move between humans, animals in the environment. And last, this is the fourth success story. And the last slide, please. Okay, and now I will need all of you not to have a funeral. So because we've managed to have One Health at the highest top level in the G7 this year, but the presidency of the next year will be the United States of America. I was in Washington a month ago in a meeting of the academies on AMR and One Health. And the discussion was, Bruno, it's quite probable that we don't have a scientific meeting with the next G7 meeting. And I said, let's try to reverse that. So I do not want to have a funeral where we forget about science and G7 and politics. So I think that all together, we should make it that science, not only this year that we celebrate and we are very happy, but also in the next year, G7 US and G7 UK, that in all the G7 meetings in the history, we have a commitment by our policymakers that science should be the driver of policy and of decision making. Thank you.
Thank you very much, Bruno. Thank you. You have managed, through your different slides of presentation, you've managed to go through the cross-cutting themes of the conference: governance, data, and social sciences as well. So, Xiong, it's your turn now. So, you're bringing in an innovation perspective, and we've learned this morning that One Health innovation was a must, and especially on vector control and environmental approaches. So, could you share with us how this innovation supports the One Health implementation in the ground? Thank you very much.
Okay, thank you for this opportunity. So, vector-borne disease is disease transmitted by insect can influence human, animal, and plant. So, good topic for the One Health. So, the disease include arbovirus disease and malaria cause a huge burden to the public health. So, for most of this vector-borne disease, vaccine and drug are either not available or insufficient for disease control. So currently, the main intervention rely on targeted insect vector, traditionally chemical insecticide. However, we all know the insect develop resistance to chemical insecticide, and also the chemical kill lots of non-targeted species and also cause pollution. So therefore, during the last 20 years, so we, and also with our colleague, working on developing the novel tool to control the vector-borne disease, mainly mosquito-borne disease, include dengue, Zika, and malaria. So next, yes. I will provide an example, so which show how during the last 20 years, we are moving to a successful product development. So these two rely on the endosymbiont bacteria, which naturally carried by insect, which is called Wolbachia. Next slide. So similar with the stereo insect technique, this technology using a pipeline which need mass production, release then you can check the influence or impact at the population level, so which you can monitor the insect population or the disease incidence. So during the last, particularly during the last 10 years, so there's significant progress has been made. So either I show the two examples, so they are published in New England Journal of Medicine to show in Indonesia, the disease dengue incidence was reduced by 77%. The hospitality was reduced by 86%. Recently, by Singapore, they're using a different strategy, which is similar with stereo insect technique to cause mosquito sterility. So eventually push down the population and also show disease incidence was reduced by over 70%. So overall, there's also other countries that show different level of success. So mainly due to the environmental condition. So World Health Organization also start to develop a targeted product profile to guard the international community to deploy this technology for dengue control. So overall, this is a very environmental friendly technology which can reduce the use of chemical insecticide, and therefore this is better for the environment and also reduce the pressure on insecticide-resistant development. So the technique is overall very successful. Next slide. So, however, there still have a systematic barrier which block move forward the technology over the globally. So mainly, the first is about there's a huge upfront cost, thus there's a huge return. So this is a technology is air-wide using to protect a whole population. So therefore, the upfront cost at the beginning is high. However, if you manage this financial slow 5 years or 10 years time, the cost is very low compared to its return. One example is a stereo insect technique for screwworm control. That for that 50-year campaign, it cost $1.5 billion US. However, in 1 year, the benefit return is $1 billion. So therefore, to operate this project, it really needs a top level, coordinated government system to deploy it. The second barrier is they need, currently there's a weak integration between the surveillance system and the operation. So if that one was integrated well, it can start a target deployment which can reduce the cost. So in addition, there's also have the regulation, community education, and the scale issue or the affect its deployment. So the recommendation for this technology to go further is basically need a better integration between the surveillance system and the operation, field operation. So for adapted deployment. And the second is have a right financial system to sustain this technology. So as I mentioned, this technology is not to protect the individual. So therefore, the involved by government is very important. And although the public-private partnership is also proposed for this technology. So for the other is the regulation also have the issue which need address the fragmentation of the regulation of this technology. In addition, the public education is also very important, which should be start from the beginning to the end of the project. So overall, this technology, I think it meets the One Health topic well and also align with antimicrobial resistant management because it can reduce the chemical insecticide selection suppression. Yeah, that's all.
Thank you very much. So Ramanan, from a global perspective on antimicrobial resistance, what does effective One Health implementation looks like? So taking the global context as well.
Thank you, Marisa, for the question. And it's a pleasure to be here. Wonderful that France is focusing on One Health as the focus of the G7 meeting, and of course to the colleagues from Pretoria who've organized this. So in advance of the, how many of you know about 2024, there was a UN General Assembly high-level meeting on antimicrobial resistance. Is that familiar to some of you? Okay. So this was one of the few times when the UN actually talks about health topics, and antimicrobial resistance was there for the second time after 2016 and then 2024. And in advance of that, we put out this Lancet series. The Lancet series was not on antimicrobial resistance, although that was the topic. The topic of this series was really on access to effective antibiotics. The reason is many ministries of health are not necessarily concerned about AMR per se. They're concerned about whether their populations can have access to antibiotics that actually work, right? And this is the right framing of the topic because we don't talk about malarial resistance. We talk about malaria. We don't talk about TB drug resistance. We talk about tuberculosis. And here, if you go to the next slide, please. I think this is an important figure to keep in mind. Every year, there are 7.7 million people who die because of bacterial infections. Only 1.27 million, I say only because compared to the 7.7, it's a large number of people, but 1.27 million people die because of antimicrobial resistance, directly caused by antimicrobial resistance. Another, total about 5 million die with a pathogen that is antimicrobial resistant, so not necessarily off it. So you have 7.7 million, you have 1.27 million, you have about 6.4 million people who could be theoretically treated with antibiotics that we have today who are not being treated with those antibiotics. So while we care about AMR, which tends to be a bigger issue in high-income countries where there's fewer infections that are preventable, in many low and middle-income countries, a lot of those 6.4 million deaths can be prevented or they can be treated using antibiotics that we already have today. So we want to keep this in mind. And another point which I want to make is, of course, which came up in the morning in the first session, which is that everything that exists in the environment as a hazard is not a risk to us. Bats may carry millions of viruses that could potentially be harmful to us, but it's a risk to us only if we go, messing around with the bats and look for them and then get the infection transmitted over to us. So hazard exists in the environment for many things, but risk is a function of whether our behavior puts us in close proximity to the hazard. So we want to not just worry about things in the environment. There are lots of things to worry about in the environment, but really our risk. And we're sitting here in France where I can drink the water out of a tap, but whether I'm in Bangladesh or India or somewhere in Africa, I can't drink the water out of a tap. So these are ways in which you can minimize the risk, even though the hazard is there. You have the same hazard of waterborne disease here, but it's not a risk to people because you have treated water. So I think that's something we want to keep in mind. The right side shows, of course, that the risk of antimicrobial resistance itself is going up, particularly in high-income countries. Next slide, please. So there are 4 things that we can essentially do, because what has happened is that in 2024, the world has agreed to reduce the number of deaths from drug-resistant infections by 10% compared to a 2019 baseline. Now, since 2019, the deaths have already gone up, so we have to reduce it by something like 25 or 30% from today to meet this UN goal that every country in the world has agreed to by 2030. So I'm sure many of you are representing countries. Your country has agreed to this goal. And how do we meet that 10% reduction in mortality? There are 4 ways. The first is we prevent infections. And this is true both for humans as well as for animals. If we have biosafety, biosecurity, we can prevent infections in animals. We can talk much more about vaccines in animals, which I'll talk about later on. But prevention is the first job, And the second part of that light blue is we need new tools for prevention. Not everything is a tool we already have. We need a lot more investment in animal vaccines, for instance. The second is we already are averting a burden with appropriate access, but we can do much more. We can actually, many people are getting antibiotics, which is the wrong antibiotic for them because they don't have diagnostics. So if we're able to make sure that people get the right drug, that helps a lot. Same for animals. The third, I think, is a missed opportunity, which is that, like I said, there are 6.4 million infection-related deaths in humans that can be treated with antibiotics that we have today. Access to effective antibiotics, which means that the drugs are of high quality, they're not fake or substandard, that they're the right drug for the particular patient. These are things we are not doing enough of. Just to remind you, at the peak of the HIV pandemic, there were 2 million deaths from HIV. And the world was obviously, responding to it in a big way. Today, we have 4 times the number from bacterial infections. Nobody's jumping up and down, right? So we have a major crisis. It doesn't have to be just about the AMR, it's much bigger than AMR even. The last one is, of course, we need new tools. We can't do it with the drugs that we have today. We need to invest in a pipeline, and we need to make sure that they are also accessible. Just coming up with a new drug is not sufficient. I think that's my last slide, but I'll just go to the next one. Yeah, that's it.
Thank you very much. Thanks a lot. So, thank you. So before we get a bit deeper into the discussion, tomorrow countries and decision makers are meeting. If you have one concrete action that you want to tell them as a first step of implementation of One Health in action in their country, what would it be? One sentence each, please. Nitish.
Well, I will basically, for my case, I will say that One Health strategic document by the government and its implementation commitment is the most important part from our experience.
Thank you, Nitish. Priska.
Thank you. I would say capacitate the communities, capacitate the grassroots level people so that they understand the importance of that integrative approach of One Health. Thank you.
Thank you, Bruno.
I would say governance. One Health governance is essential. And it's not digital communication between ministries. It's a physical, face-to-face place where people work from a One Health perspective. So governance is probably essential.
Thank you, Xiong.
I'm aiming for vector-borne disease. So I think build a cross-sector coordination mechanism to link the surveillance with intervention action for a disease is the most important.
Thank you, Ramanan.
Vaccines for both animals and humans, and improved water and sanitation to prevent infections, and improved access to the antibiotics that we already have without having to wait for new ones.
Excellent, thanks a lot. So now let's get into a bit more details on how we can really implement this. So Nitish, we've just heard, and Xiong pointed out that cross-sectoral coordination is very important. What is the secret to ensure that ministry talks together?
Thank you. This is an interesting experience. When we developed a One Health strategic framework, we took 3 years to really convince the government that this is the guideline that you need to follow for Bangladesh. And that was approved, and we started to practice it. This is number one. And we developed a One Health Secretariat, based on this strategic document. And that secretariat was basically working as an operationalization unit, coordinating at higher level, 3-tier coordination mechanism we have established. And finally, what I would also say, the commitment does not come automatically. You need some pioneers, champions, and they can influence. It's not only government, but also you need other people to influence the government. And for that thing, development partners, civil society play a very important role.
Thank you very much. Well, we'll get into civil society right now. So, Priska, how do you engage the community? And what did you learn with the capacitating program, especially from the stakeholder mapping? Can you tell me more?
Okay, so within COHESA, we had a lot of activities on net mapping of stakeholders, starting with the higher level, national level, which is quite the common and normal, but we also went down to the communities and the villages and facilitated them to describe who are and who should be the partners in terms of, in a specific case, how they manage their grazing areas. And we learned that the more they got thinking about it, they brought up partners that perhaps they would not normally have thought about. For instance, if you are grazing your animals, how does the human health sector come in? And then they were talking about issues to do with beef measles that can come up from animals in grazing areas, picking up on human excreta, and then it affects the animals. And then when those animals are sold for slaughter, they are, what's the word? They are rejected. They can't be bought and sold. So it was a great learning experience, rather than give them a lecture on One Health, but by saying, who do you think should be working together? They brought up these diverse stakeholders, which was quite important. Thank you.
Thank you very much. So Bruno, tell us more about the leverage that enabled policy reduction in the use of antimicrobial, and what was the role of farmers and the private sector played in this reduction?
Thank you. So as you know, or it is widely known, that the National Action Plan in Spain is quite successful. It has been able to reduce 70% of use of antibiotics in animals and 11% of antibiotics in humans. The secret probably is as I said, the governance. The people that are governing the National Action Plan in Spain is the National Medical Agency. And the National Medical Agency in Spain, I know in France it's not the case, manages human medicines and animal medicines. So people that are working in the same building for the last 40 years, that eat together, have fun together, go to work together, and breakfast together, and know themselves, they are managing from a One Health perspective. And so the other people, the others means the strange people from the environment that are working in the environment, or these people that are working only in hospitals and don't look outside the hospitals, or those people that are only with animals, they know each other. So they know exactly that, for example, genomics is essential, that epidemiology is good, that they are all making the highest effort they can, so they're not pointing to each other. One of the limiting factors of One Health is probably the blame game. So, no, why should I do something? Because these people, you know, in the hospital, they are using too many antibiotics. Or the people in the hospital say, well, they are using too many antibiotics in animals. Why should I do something? But if you talk to each other and then you see that each one should just do in your own square meter what you have to do, then the things work. So probably having a One Health perspective from a governance point of view, from people that know each other, is essential. And then obviously, counting with farmers, counting with patient associations that we often forget, and counting with industry. So the industry manages many animals that you slaughter. The industry sells and develops vaccines, as Ramanan was saying very well. So the industry has to be taken on board. It's not the public. We really have to take into account all the private sectors, including the pharmaceutical industry and the animal production and the food industry, because they are essential players. And if we take all of them together without blaming each other, then the things will go on like they are doing in Spain.
Thank you very much. Yeah, the question of acceptability and implementation is key, especially when you get to One Health innovation. So Xiang, can you tell us what are the key important elements to be able to implement One Health innovations that science is developing?
Okay. So for the pilot trial, mainly try to prove it works. However, for the deployment, which is required, build a system which can deliver the technology effectively. So at this stage, it is very important to secure government ownership of this technology, and also which will help establish sustainable financial system, and also build the operation infrastructure, like the technology we are working on, need a manufacturer, need a logistic system build. So the last is also need a clear that regulation pathway. So the technology we develop is very important to be integrated in the national program, such that it can deploy sustainably.
So yeah, the support of governments is very important, and the private sector, I imagine so too. Thank you. Ramanan, so can you tell us, we've heard about the reduce in funding, and how can we really implement a realistic One Health AMR intervention package in low resource setting? What would be the key?
Thanks, Marisa. So low resource settings, I don't think are the real problem places, because those don't have much antibiotic selection pressure, and they are not also, in a One Health sense, producing the number of animals, for instance, that could pose a risk. The problem is in places that are transitioning with scale. They are in Africa, they're in Asia, where the scale means that people have rising incomes, that they have better access to antibiotics. Farmers have better access to antibiotics, and they're also producing far more animals than they used to in the past. So in that transition from low resource to mid resource or high resource settings is an opportunity where if we can set standards and expectations such that antibiotic use is prevented, minimized with better prevention through vaccines, water sanitation, and there's better education, high-income countries can transfer knowledge. I don't think this is an issue of funding that is the barrier to doing things better. It is simply a function of knowing how to raise animals without using antibiotics, or how to even do human medicine without relying so much on antibiotics. That is the problem. So it's that transition place which many countries are in that I would worry about the most.
Thank you very much. So, yes, go on.
Also, it's in the animal sector, but it's also in the human sector, because we're constructing hospitals in South America, we're constructing our hospitals in Africa. So also there we have an opportunity to construct them with the proper infection control measures, etc. So it's in all areas.
Thank you. And it's important to highlight that prevention and risk reduction can be implemented at low cost and high impact. And let's get into this a little bit more. So Priska and Nitish, and I'll start with Priska. Can you tell me what would be the lowest cost intervention, highest impact in the ground?
Dare I repeat, Marisa?
Yes, please do so.
I think really capacitation, especially at the food systems level, because that's where the most interfaces are happening, the most interactions. We've just heard that people then tend to use a lot of this technology which lead perhaps to greater risks. So I think let's capacitate our grassroots level in whatever sectors they are involved in, particularly in the agriculture and food systems capacitation. Thank you.
Thank you. Nitish.
Well, we need to cite an example in the front of the policymakers. One of the best way of prevention, when you talk about prevention, I think rabies control at source is the best example, and that worked very well in our case, I have seen. So one important example can make a lot of impact for other things. So rabies control, say for example, as a preventative case in mass dog vaccinations and others, is a very good example that you need to cite. Thank you.
Thank you very much. And then I will ask the question, so then who needs to pay? And I'll turn to Ramanan for that, because we just talked about funding.
Well, let me focus on one thing, because I brought up animal vaccines, and I think animal vaccines are a terrific intervention because they help reduce the use of antibiotics. They are great at improving farmer livelihoods and reducing poverty. They actually improve farmer productivity and also reduce the carbon footprint, which means that they're a great climate-related intervention as well. They're also good for preventing diseases from spilling over from wild animals into domestic animals. So take something like animal vaccines, which is fabulous, provides many public goods. Now, who should pay? Certainly not the farmer, because the farmer is not reaping all of those benefits to do with climate change or AMR and all of that. It really is someone else. But we are spending those monies on carbon mitigation. We're spending the money on pandemic preparedness. We're spending the money in all sorts of places, but on I can't figure out exactly what, but if we can figure out these kinds of interventions which actually reduce poverty and can be subsidized for farmers, animal vaccines should be made very cheap or free of cost. But today we treat them as a commercial input, and I really think that this should change. It will be one of our best interventions in One Health.
Thank you, and that will definitely improve accessibility and acceptability. Xiong, I turn on to you because the innovations sometimes raise a lot of ethical and societal concerns. Can you tell us more about your, in link with your innovation?
Oh, yeah, this is related to the community education. So this is always one of part of the implementation process. We always suggest it should start very early and transparent and across the entire process. So this should not be done after the decision already made. So basically, if community support is getting, then the technology can deploy. So the main thing is for our technology, we are release mosquito into the human society. So this is kind of a sensitive issue. And also this is released to the public place. So therefore, this public trust is an essential part. It should be treated as important as scientific evidence for efficacy for a responsible One Health implementation. Yeah.
Thank you very much. Engaging public and getting their trust is key. And you mentioned earlier that to be able to scale up innovation, we need governance. So Bruno, I'll turn on to you. How do you break silos for who's taking leadership, or how do you coordinate governance and government engagement for such innovations?
I don't like very much the term to break silos. I'm a bit against this, Marisa, sorry. So because I like vertical knowledge. So I think that the medical knowledge is very important, the biological knowledge is very important. So the silos are fine there. You don't have to destroy them for One Health. You have to build physically, I said, bridges between the silos. So I'm more for bridging between silos than for breaking them. So that's absolutely a must. I want to answer to the question of sustainability and who has to pay for that, as you said. With antibiotics, it's very interesting that the market of the antibiotics is completely broken. There's no company that has more than 500 workers today that is developing antibiotics. So nobody is developing antibiotics. Industry is not a non-governmental organization, so they prefer to develop anti-oncologists, etc. So now we have decided in Europe that we use public money that we are going to give to the industry to make them develop antibiotics that will save our lives. So look to what extent One Health needs not only medical people, veterinary people, and environmental people. We're working together with economists because we need economic models to attract the pharmaceutical industry back again to the antibiotic market, and that's what we are doing. And the other area that I think is very important is behavioral change. So I think that the behavior of humans is very important in automedication, in the concept against antibiotics. I saw today an advertisement in the French TV, which was, quand tu es malade, tu n'as pas toujours besoin des médicaments. So behavioral change is important, that when there's a disease that we don't need antibiotics always, has to be in the brains of every European, of every French, and also of every farmer, as Ramana is saying very well. So I think that behavioral change is very important, and also that we work together with the industry because they need us, and we need them to develop antibiotics against last resort antibiotics. It's only 1.2 million, but it's 1.2 million people that are dying, that are given the last resort antibiotics, and they still die. Your grandfather, my grandfather, your sister, of an acquired infection after a normal surgery, there's a bacterium that comes, and no antibiotic can cure this person. So we need also new antibiotics, and this is why we also have to engage our budget, our public budget, to let the industry develop new antibiotics.
Thank you very much. You've already taken us into impact and long-term sustainability. I'll turn on to you, Priska. How do you ensure sustainability of capacities in countries?
I was actually raising my hand to make sure I mentioned. I think it would be wrong for us to end this discussion without speaking about co-designing of solutions. It's not about us coming in our briefcases as the capacitator. We come to the capacity, and then it has to be co-designed. It has to be according to their contexts, according to their needs, according to their realities. And then we say, what is the best? What would be the best way forward in order to have that integrative approach? So I think co-designing solutions, Marisa.
Thank you very much. Nitish, how do you ensure long-term governance, even in situation when resources might be reducing as well, to be able to cover that?
Yeah, I can cite one example. When we started One Health Secretariat, we secured very small amount of funding from the government. It was very small, but that was a good indication. And then we continued to really advocate to the government, look, this is a good example and it works, why not to really expand it? And we negotiated with the government, development partners, we got some support, but finally, the last one, which is government has decided to go for 250 million US dollar project with the three ministries, Ministry of Health, Ministry of Fisheries and Livestock, and Ministry of Environment and Forest together. It took a lot of long advocacy, but finally agreed, and we are about to implement these things. And this is one good example how a small thing can really expand the activities and sustainability. And we are focusing on the system strengthening, not only the activities, the system got to be strengthened through these projects. And that's what is the, we believe that it will give some sort of guarantee for the sustainability. Thank you.
Thank you very much. Endorsement of the action into the national budget with the Ministry of Finance is a key for sustainability. Thank you very much. So before we open up the floor for a round of questions, I would like to ask you all, again, in a very short sentence, what would be your key messages from this session and how to implement One Health in action in the field to tackle emerging infectious disease and antimicrobial resistance risks? In one sentence, Ramanan.
Stay focused on the UN goals, which are a 10% mortality reduction in humans, reduction in inappropriate use in humans, and reduction in inappropriate use in animals. I don't think we need any other measure beyond that. If we can see if the One Health action that we are thinking about can contribute to those goals, we're on the right track. If it's not on the right track.
Thank you very much. Xiong.
Okay, so mainly my experience is the innovation always occurs faster than the public health system. So therefore, we need a system which are able to absorb and take and financial and regulate all this novel technology at the scale. Yeah.
Thank you, Bruno.
So we know what steps we have to take. The challenge now is to convince our policymakers that science and these decisions that we have taken all together in the world, in the United Nations, in the WHO, in the quadripartite, and also here in this meeting, stay in the top of the agenda for the rest of our history.
Thank you. Priska?
I would say it's important for us to invest time and human resources and finances, if need be, to understand the context, because these interface spaces are not homogeneous. They come with their own peculiarities, so we need to really understand what those contexts are before we go in with supposed interventions. Thank you.
Thank you, Anitish.
Yeah, I agree, all of them what they said, and I will say that 4C, communication, coordination, collaboration, and capacity building. It is a continuous process, and One Health is badly needed at this time. Country like Bangladesh, without One Health, survival is very difficult. So we need to follow that one. Thank you.
Thank you very much. So now we will take questions from the floor that you would have written in the Mentimeter app. If you haven't done it, you will have a few minutes to be able to do so. because we will take first a question from Dr. Anne-Laure Bagnuls, directrice de recherche à l'Institut de recherche pour le développement. Anne-Laure, the floor is yours.
Thank you.
Can you open up the microphone for Anne-Laure?
Thank you very much, Marisa, for giving me the opportunity to speak today. I would like to thank very much the panelists for the very interesting and very important discussion today. So just to complete, I'm working at in RAD, CNRS, and University of Montpellier Laboratory, and we are focused on ecology and evolution of infectious disease and vectors, included antimicrobial resistance. So I'm also involved in PRESOD initiative as scientific focal point and regional focal point for Southeast Asia. So I would like just to, before to ask my question, to emphasize here what the panelists already mentioned. The One Health approach can no longer be seen as just a conceptual framework. It must be actively implemented. It needs to become a real driver of transformation in the way we produce knowledge, collaborate, and most importantly, prevent and control the risk related to infectious disease and antimicrobial resistance. I'm sure that everybody here agrees that the objective is clear, that it is important to move towards sustainable, equitable, and co-construct solution. Solution needs to be based on solid scientific data, but also deeply rooted in local realities. So to achieve this, we need a truly multidisciplinary approach, even if we can keep the silo. So it is very important. The challenge we face, whether infectious disease or AMR, are embedded in interconnected system at the interface between humans, animals, and the environment. So addressing them requires integrating biology, ecology, climate science, human and veterinary medicine, as well as social science. So take antimicrobial resistance as an example. As you said before, it is not just now a hospital issue. It is circulates everywhere in rivers, agricultural system, aquaculture communities, and between domestic and wild animals. So furthermore, it can be amplified by pollution, by climate, and other environmental change. It's the reason why it is really important to understand these dynamics to guide effective prevention strategy. But this is not only a scientific challenge. It is also requires rethinking how we build sustainable collaboration, as you said. And in my institution, so at RAD, we are working in this direction through structuring tools such as international joint laboratories, young associated teams, international research networks, and also arts training programs that are co-lead with partners of Global South. So these mechanisms aim to build long-term scientific capacity firmly anchored at the local level. So the goal is not only to produce data, but also to ensure its relevance and make it accessible and useful for partners in countries where the challenge, of course, are most critical. So strengthening local capacity, anchoring research in territories, and establishing equitable horizontal partnership are essential to co-produce knowledge that can drive systemic transformation. And we must, of course, never forget that local actors, such as community human and animal health workers, for example, often on the front line of emerging risk, hold invaluable expertise that must, of course, be fully integrated. So this implies, as you say, that rethinking how knowledge is produced, shared, and used, and we need inclusive and reciprocal approaches that can address global challenge while respecting local specificities. So while these approaches are well developed in some fields, I don't know if you will agree with me, such as the social science, they still need to be strengthened in other, including biology, ecology, and epidemiology. So yes, yet it is essential if we want to better anticipate emerging risks, strengthen prevention, and improve the control of health stress. So the way forward is clear: integrated science, territorial approach, equitable partnership, and sustainable impact. So in this context, my question for you, the panelists, is what in your view is still missing today to strengthen international exchange and the sharing of expertise? What are the main barriers? And can you share a concrete example where experience sharing between countries has helped better control or prevent the spread of AMR, of infectious disease, through the One Health approach?
So, Ramanan, yes?
Thanks for that question. I think that's a great question. In human health, there is no problem because countries are willing to help other countries and share information because there is an understanding that if I prevent a disease somewhere else, it helps me as well. To some extent, I think some countries are forgetting this lesson, but by and large, I think the world lives like this. That's why we have WHO and so forth. Where we have not making that learning is in the case of animal health, where we fail to recognize that preventing disease in animals in another country actually helps us as well because that disease can move. We tend to treat information on animal health much more like a commercial secret, and therefore we don't help other countries when we do it so easily for human health. This, I think, is a big failing of One Health. And unless we fix this and don't see animal health purely in commercial terms, we will never really solve One Health. Thank you.
Thank you, Bruno.
Yes, I can give you an example. There are some exceptions. So as I told you, we've reduced use of antibiotics in Spain a lot. So Chile has come to us, the government, and they're copying. They are reproducing exactly the same model that we have done, which was no legislation to forbid antibiotics in animals, but just to cooperate with the industry. And they're already for 2 years working on this model, and this is working very well. So no blaming the industry that you are doing something. Let's work together. Let's reduce colistin use. For example, they are still using colistin. So let's reduce colistin down to 0. Let's reduce antibiotics. So the models, if you tell them properly, can be translated from one country to the other, and they are. So success stories are translatable from one country to the other. And I wanted also to thank all the organizers, Eric and all of you, for this excellent meeting.
Thank you, Bruno. Nitish, you wanted to say something?
Well, in human case, we have essential veterinary drug, essential list of essential medicine. I think it's similarly in the veterinary field, we need a sort of list of the veterinary in the globally that will help. One example, social science can play a very important role. One example is the Nipah in Bangladesh. When we got the Nipah, we did not have big population of pig, no intermediate host for the animal. And we identified with the help of the anthropologist and other group of people that it is PAMSEP, which is really disseminating the Nipah virus to human raw form. And that knowledge is a very simple one, but it works so well. And that is the knowledge we generated for the global community with the participation of the anthropologists, veterinarian, and human health. Otherwise, it would not have been known. So I think similar case can be cited an example for other cases. Thank you.
Thank you, Nitish. Priska, I want to give you the floor because you need to talk about the COISA programs where countries are really sharing their experience to be able to capacitate each other on One Health. Can you tell just a little bit more on that country sharing experience in that network?
Yes, the one big emerging part of the future for us as COHESA is the formation of more of a regional network. We have a lot of One Health networks in Africa, but what we have learned in COHESA has empowered us to think perhaps we really need to come together as one regional network so that we can share these experiences, especially technical experiences, strategic experiences, policy. But I also wanted to mention one issue, Marisa. One thing that we have learned even as the COHESA group is that the school teacher is an important partner. I don't know if it's politically wrong to even call them an important tool, because they are interfacing with our next generation of society from an early childhood. And I would say all of our 12 countries have had some effort into curriculum development, curriculum modification. And the school teachers that we have spoken with, they've actually said it makes it easier to teach what they would normally call content or environmental science and bring everything together and teach the children that there are connectedness. There is connectedness that we can approach. Thank you.
And that's what happened at the One Health Village of the Discovery yesterday, where children were involved into learning more about the One Health concept. We've got time for a few questions from the audience, and that will be provided by one of the rapporteurs. I cannot see you, you're behind the stall.
Yes, oh, thank you, yeah. So yes, my role is to capture the questions from the audience. There are many, many questions. I can start with one of them. You mentioned, Bruno, what is the role of the civil society? We know that they are very much impacted by those problems. We also know that in certain infectious diseases, I would think of HIV, for instance, the role of the civil society was very important. What should be the role of the civil society in the One Health approach, covering all these diseases, and including AMR, of course?
Well, I think luckily enough, with COVID, the society got finally the perception that what is happening with the virus in China, in the environment or something, can have an impact in their day-to-day life. So I think that after that, it is not so difficult that the society understands that what is happening in a river and in a stork, as you showed in your picture, of Pablo Laborda, and what is happening in a virus in whatever place can have an impact in their life. So I think since then, it's important, and they realize that contaminating, that taking the medicines and throwing them to the dustbin, that the wastewater in Ghana, and the wastewater of the hospitals in Ghana flowing into the river, that is being then the drinking water of the villages, is not such a good idea. So I think since then we are having the pressure from the society, because it has to be a bottom-up, like this meeting today. It's a bottom-up meeting. It's a bottom-up. So as I said, for 20 years making pressure, scientific pressure, finally the politicians took it. So it's a bottom-up. People are knowing and realize that what is happening in the environment and what is happening with animals is essential for their safety and for their health. So the role is important, and I think today it's more than ever they've realized that.
Another question?
Yeah, sure. An interesting question, I think, change paradigm on biodiversity. Biodiversity can be a solution rather than only a reservoir hazard. So how we can change the paradigm and explore how biodiversity can limit transmission and adaptation. So.
Who wants to take this question? Ramanan?
I can address that a little bit. I think this is it's an interesting question, but it's not a straightforward question. Because biodiversity doesn't exist to protect us from disease. There are cases where increased biodiversity might put us at risk for disease. The case for protecting biodiversity shouldn't depend on only the human perspective. I think that's a very narrow way to think of biodiversity. If we thought of it that way, then we would alter the environment like we've tried to do. Maybe getting rid of mosquitoes. All this stuff is things that we try to do. But I think these are questions that are best kept separate. We want to keep the biodiversity in and of its, for its own sake. But I think we want to minimize our risk. That's why I want to make the difference between hazard and risk. There are many hazards that are out there in the environment, but we should just make sure that we as humans are able to protect our large populations from a risk perspective.
Yes, but aren't we the main risk?
We're the risk of biodiversity, but in the sense that biodiversity poses a risk to us, that's very controllable for us. If you don't go looking, if we keep distance between humans and bats, for instance, which have viruses that could affect us, that's a good protection for us. If we engage in washing hands, if we have clean water, that's all barriers for us in protecting us. I think that's where we really need to focus on One Health, which is on putting up that barrier so that we are protected from the risk, but not try to modify the environment on large scale. I mean, if I have 30 seconds, I'll give you an example. Last week, there was a study in Nature showing that droughts increase the risk of AMR in the soil because it selects for these resistance genes in the soil. So there are many things going on in the environment. We can't go modify all of that. We can only make sure that we are protected by using antibiotics appropriately, having infection control, and I think that's what we should focus on.
Yes, but at the same time, we are deforesting, we are intensifying agriculture, so we are impacting the environment. So there is still a lot of things to do to be able to reduce those risks that we are creating as well for the human. Prisca, you want to react to that?
Yes, I like the example of the biodiversity, even at the floor level. I think last week there was also a publication that talked about the link between our herbicide usage and even the microbiota in the soil. And I think the paper was even linking it to AMR. So I think we don't take a narrow view, just the above ground. But a lot is happening in the soil that has a lot of future impacts, including what we do with our grazing animals, the way we move them around, the way we allow them to overgraze over an area so that it remains a desert, has implications for us in the future. Thank you.
Thank you very much. Oh, you did it at the same time.
I can share a little experience from the mosquito field. So I'm using Hawaii as an example. So the one mosquito species causes problem for the native bird, so nearly extinction. So therefore, the Hawaii start a campaign want to eradicate that species using the technology I just proposed. So sometimes one species is toxic to the other, will affect the ecology system. So when we are remove this species, indeed, it is try to restore the ecology system. For that Hawaii example, particularly, that species is invasive mosquito species. They are initially not belong to that area. Okay.
Thank you. Last comment, Bruno?
Yes, that's what I was telling before, was that we also have to learn from the indigenous populations in Latin America and in Africa, because their equilibrium with the environment is much stronger than our invasive culture, deforesting and having access, obviously, to new infectious diseases, new bacteria, new viruses that then finally will counterattack us. So that equilibrium we have and must learn from other cultures, absolutely.
Thank you very much. Well, thank you very much. This is the end of our session. So I just want to emphasize that one more. No. Okay.
Okay, one more question. That's what was done. Okay, yeah. Okay, last one. Women and young girls are disproportionately impacted by health, especially in developing countries. So the question is, how is gender dynamics introduced in EID and AMR discussions?
Ramanan? Prisca? Prisca? Yeah, go on, Prisca.
We had an activity a couple of years ago where we were looking at livelihoods. And the issue came out from the communities that they needed water, readily accessible water, and solar powered, so that they don't use manual. But I wanted to give you an example where it's what is it in terms of animal health? It's mandatory for each village to dip their animals to protect against those parasites like ticks. And when your village is having their animals dipped, you bring something like 20 buckets, 20 times, 20 liter buckets times 12 per household. Can you guess who is bringing that water? Can you guess? It's women. So when you put a solar-powered borehole to dip the animals that the men own, especially the cattle, it's the women who are hauling that water. So sometimes these development activities is the burden of women and girls in ways that we normally don't appreciate. Thank you.
Thank you very much. Yeah.
Yes.
Ramanan had a comment, and I'll get back
yes,
to you, Bruno.
I lead a project in Ghana on breastfeeding. So breastfeeding and infection prevention control is essential. So learning, teaching from the universities, so University of Ghana and the University of Tamale, we are going to the villages and teaching breastfeeding, hand washing, what are bacteria, etc., and the results are incredible. So women immediately realize hand washing is essential. I have little animals here, and from now on, we've been able to decrease infant mortality for more than 20%, only because of these courses of teaching One Health, handling, and the breastfeeding. So I think that the role of women, especially worldwide, but also in Africa, is essential.
Yes, I just want quickly to reflect on Priska's comments. Women are often involved in the action, in raising, breeding the animals, and very little in the decision-making on how practices should be. Ramanan, last comment?
We've done an extensive review on gender and AMR, so I won't summarize it. Please go to the One Health Trust website, where all of this is on our extensive webpage, includes what Priska just said, but also this point that women are decision makers for what the family eats, which is a major source of how infections come in, particularly foodborne pathogens. They're also decision makers on child health. And especially not just the mother, the grandmother ends up being a very important decision maker. So I think our avenues to be able to influence a One Health agenda necessarily go primarily through women in many settings.
Thank you very much. So this is the end of our session. Okay, thank you. So the session has showed us how to move from experience to action, thanks to our great panel. Your contribution has helped to identify practical pathways to operationalize One Health and at scale and in a long-term sustainable way. Just some key messages very quickly, because you will find all this also in the recommendations that were backed up by this experience and example. Prevention and risk reduction is essential. Governance and coordination are critical, and it's also a driver for implementation. Local engagement is a must, trust is a need. Antimicrobial resistance requires a system approach, and scaling requires commitment and financing, including long-term and domestic ones. Thank you very much. Thanks a lot.
Thank you, Marisa, and thank you to all our panelists. Ladies and gentlemen, we're now going to break for lunch, and I'd like to invite you to please be back in the room at 1:25 so that we can kick off at 1:30 as planned. Thank you very much.
Thank you.